So we start this session, which we have written, we've titled it as Using Your Own Brain to Diagnose Neuro-Ophthalmic Conditions and Prevent Eye Surgeon Dementia. This is important because we become cataractologists. I don't even know how to pronounce this word, don't even know whether it exists in the dictionary, but basically we become people who are so used to doing cataract day in and day out that we often find people who don't have cataract to be a bit of a distraction. I have high volume surgeons who train during their MD and MS days in everything to do with ophthalmology, including chalazion and squint and DCRs and everything. But slowly along the way they've dropped everything, so they won't even do a chalazion for a patient because it wastes time which can be more productively, financially productively spent in doing a cataract surgery. Takes about the same amount of time. So it's important that it's not always that we have the luxury of working in big cities where you have specialized people like Rashmin and Naveen whom you can bump your cases which you don't like to. Somebody with an odd pupil, somebody whose eye doesn't move the way it should. Let them manage, let them do something. Or it's a headache. Patient comes with a headache, it's more of a nuisance to you. You're not interested in solving that headache because it doesn't have the malignant lens-induced glaucoma as the cause. So I think we need to widen our horizon and become more complete ophthalmologists. You may not do the final treatment, but at least basics you should be able to rule out, so that those patients will bring you perhaps cataract patients as well. So it's important to use our own brains. This is the reason. General ophthalmologists usually send a patient with a neuro-ophthalmic case to the handful of neuro-ophthalmologists in the country, or if the patient and the surgeon are in a town or district place which doesn't have one, they refer all these cases to a general neurologist or an MD physician who will promptly order an MRI. Within 15 minutes of seeing the patient, an MRI is ordered always to protect his backside. So the object of this course is how to use simple tools which you have with you in your clinic to explain unexplained visual loss. Which headaches can be diagnosed and treated without asking for MRIs. There are several interesting cases which our experts have diagnosed clinically, and the importance of small things like the pupil and eye movement, which can tell us such a lot if we are only willing to listen. So I have introduced the course to you. I will tell you a little bit about what have I missed in unexplained visual loss. We have Dr. Rashmin who will follow, and then so this is from another course. Apologies. So let's just get on with the course with no more surprises. Thank you.